Hi everyone, I'm Dr. Jin-hee Park. If you're getting ready for the IFM board exam, let's evaluate your cardiometabolic module readiness with 10 practice questions aligned with the new exam format. When I passed the boards in July 2025, I found that actively working through applied questions like these was one of the most effective ways to prepare for the exam and actually pass it. Pause before the answer appears, think through your reasoning, and keep track of your score as we go. And also hit the subscribe button so you can follow the full IFM board review series on this channel. Okay, let's get started. Question number 21. A patient presents with high sensitivity CRP, elevated myeloperoxidase, and low HDL2. Which functional medicine matrix node is the most appropriate primary focus for these specific biomarkers? A. Transport. B. Defense and repair. C. Energy. D. Communication. And the correct answer is B. Defense and repair. So elevated high-sensitivity CRP and myeloperoxidase reflect systemic inflammation and oxidative stress, while low HDL2 indicates reduced antioxidant protection. So together, these biomarkers point to dysfunction within the defense and repair node of the IFM matrix. A is incorrect because transport refers to circulation and lipid movement, but these biomarkers indicate inflammation, not transport dysfunction. C is incorrect because energy node relates to the mitochondrial function and metabolism. D is incorrect because communication focuses on hormones and signaling molecules such as insulin or adipokines or neurotransmitters. So overall, the correct answer is B, defense and repair. Question number 22. When addressing transport dysfunction in the context of cardiovascular health, which clinical indicator is most suggestive of impaired lymphatic drainage or peripheral vascular flow? A. Pitting edema in the lower extremities. B. Diagonal earlobe crease, also known as Frank's sign. C. Xanthomas on the eyelids. D. Acanthosis nigricans. And the correct answer is A, pitting edema in the lower extremities. So within the functional medicine matrix, the transport node relates to circulation and lymphatic flow. Pitting edema is a classic clinical sign of transport dysfunction because it reflects impaired fluid movement through the vascular or lymphatic systems. B is incorrect because Frank's sign indicates atherosclerosis risk, but not fluid transport dysfunction. C is incorrect because xanthomas indicate lipid metabolism abnormalities, usually related to dyslipidemia. D is incorrect because acanthosis nigricans is a marker of metabolic dysfunction and hyperinsulinemia. So overall, the correct answer is A, pitting edema in the lower extremities. Question number 23. Which mechanism best explains why niacin, in other words, vitamin B3, is often used to treat pattern B LDL profiles in functional cardiology? A. It binds to bile acids in the gut to prevent reabsorption. B. It shifts LDL particle size from small, dense, to large and buoyant. C. It inhibits HMG-CoA reductase to lower total cholesterol. D. It acts as a direct antioxidant to prevent LDL oxidation. And the correct answer is B. It shifts LDL particle size from small and dense to large and buoyant. So niacin improves pattern B dyslipidemia by shifting LDL particles from small, dense forms to large, less atherogenic particles, while also increasing HDL2 and lowering triglycerides. A is incorrect because binding bile acids in the gut is the mechanism of bile acid sequestrance or fiber. C is incorrect because inhibiting HMG-CoA reductase is the mechanism of statins. D is incorrect because niacin's primary role is lipoprotein metabolism. It's not antioxidant activity. So overall, the correct answer is B. It shifts LDL particle size from small and dense to large and buoyant. Question number 24. A patient with hypertension shows a non-dipping blood pressure pattern. Which lifestyle intervention is the highest priority for restoring the normal nocturnal dip, according to the module? A. Increasing vigorous exercise to 5 days a week. B. Switching to a high-protein, low-carb diet. C. Supplementing with high-dose vitamin C. D. Improving sleep hygiene and duration, 7 to 9 hours. And the correct answer is D. Improving sleep hygiene and duration, 7 to 9 hours. So a non-dipping blood pressure pattern often reflects autonomic imbalance and poor circadian regulation. So improving sleep hygiene and achieving 7 to 9 hours of sleep helps restore the normal parasympathetic shift at night that allows blood pressure to decrease. A is incorrect because exercise improves blood pressure overall, but does not directly correct nocturnal dipping patterns. B is incorrect because diet can affect metabolic health, but sleep is the primary regulator of circadian blood pressure rhythms. C is incorrect because vitamin C may support vascular health, but does not restore autonomic circadian regulation. So overall, the correct answer is D, improving sleep hygiene and duration, 7 to 9 hours. Question number 25. In the functional medicine matrix for cardiometabolic disease, lipotoxicity is categorized under which node? A. Assimilation. B. Structural integrity. C. Communication. D. Energy. And the correct answer is D. Energy. So lipotoxicity occurs when excess fatty acids accumulate in non-adipose tissues, leading to mitochondrial dysfunction and impaired energy metabolism. And because this process disrupts cellular energy production, it is categorized within the energy node of the functional medicine matrix. A is incorrect because assimilation relates to digestion and nutrient absorption, not intracellular lipid toxicity. B is incorrect because structural node refers to cell membranes and connective tissue. C is incorrect because communication node involves hormones and signaling molecules, not mitochondrial fuel toxicity. So overall, the correct answer is D, energy. Question number 26. Which specific laboratory marker is used in functional medicine to track vascular wall inflammation and specifically indicates the risk of an unstable plaque rupturing? A. Fasting insulin. B. Total cholesterol. C. Hemoglobin A1C. D. Lipoprotein-associated phospholipase A2. And the correct answer is D. Lipoprotein-associated phospholipase A2. So lipoprotein-associated phospholipase A2 is an enzyme produced by inflammatory cells within atherosclerotic plaques. Elevated levels of this enzyme indicate vascular wall inflammation and suggest that a plaque may be unstable and prone to rupture. A is incorrect because fasting insulin is a marker of metabolic dysfunction and insulin resistance, not of plaque instability. B is incorrect because total cholesterol measures lipid levels but does not indicate plaque inflammation. C is incorrect because hemoglobin A1C is a marker of long-term glucose control but not vascular inflammation. So overall, the correct answer is D, lipoprotein-associated phospholipase A2. Question number 27. Which of the following interventions is considered a secondary treatment on the IFM cardiometabolic clinical decision tree? A. Targeted phytonutrient supplementation, such as bergamot. B. Prescribing the cardiometabolic food plan. C. Regular physical activity. D. Stress management techniques. And the correct answer is A. Targeted phytonutrient supplementation, such as bergamot. So in the IFM cardiometabolic decision tree, lifestyle interventions such as diet, exercise, and stress management are primary treatments. The targeted phytonutrient supplementation, such as bergamot, is considered a secondary intervention used to further modulate physiology. B is incorrect because prescribing the cardiometabolic food plan is a primary lifestyle intervention. C is incorrect because exercise is also a primary intervention. D is incorrect because stress reduction is a foundational lifestyle therapy. So overall, the correct answer is A, targeted phytonutrient supplementation, such as bergamot. Question number 28. A practitioner is using the FITT criteria to prescribe exercise for a patient. If the patient is performing resistance training, what is the recommended frequency according to the ACSM guidelines? A, 150 minutes of vigorous intensity daily. B, daily sessions of at least 60 minutes. C, once a week for full body exhaustion. D, 2 to 3 days per week for each major muscle group. And the correct answer is D, 2 to 3 days per week for each major muscle group. So according to the ACSM guidelines, resistance training should be performed 2 to 3 days per week, targeting each major muscle group. And this frequency allows adequate recovery while supporting strength and metabolic health. A is incorrect because 150 minutes of vigorous exercise daily refers to aerobic exercise guidelines, not resistance training. B is incorrect because daily heavy resistance training may lead to insufficient recovery. C is incorrect because 1 session per week is insufficient for strength and metabolic benefits. So overall, the correct answer is D, 2 to 3 days per week for each major muscle group. Question number 29. Which specific matrix node is involved when a patient has endothelial dysfunction, leading to impaired vasodilation? A, structural integrity. B, assimilation. C, energy. D, biotransformation. And the correct answer is A, structural integrity. So endothelial dysfunction reflects impaired function of the vascular lining. And because the endothelium is a physical structure within the blood vessel wall, this condition falls under the structural integrity node of the functional medicine matrix. B is incorrect because assimilation node relates to digestion and nutrient absorption. C is incorrect because the energy node involves mitochondrial metabolism and ATP production. D is incorrect because biotransformation node refers to detoxification and liver metabolism. So overall, the correct answer is A, structural integrity. Question number 30. A patient with a history of heart failure is taking a loop diuretic and presents with worsening fatigue and muscle weakness. Which specific matrix node is most directly impacted by the likely nutrient depletion caused by this medication? A, biotransformation. B, energy. C, communication. D, assimilation. And the correct answer is B, energy. So loop diuretics can deplete thiamine, which is a critical cofactor for mitochondrial ATP production. And because thiamine deficiency impairs cellular energy metabolism, this drug-nutrient interaction primarily affects the energy node of the functional medicine matrix. A is incorrect because biotransformation node involves detoxification and liver metabolism. C is incorrect because communication node refers to hormones and signaling molecules and neurotransmitters. D is incorrect because assimilation refers to digestion and nutrient absorption, not cellular energy metabolism. So overall, the correct answer is B, energy. This was Cardiometabolic Module question set number 3. If you're preparing for the IFM board exam, subscribe to this channel because I'm building a full library of practice questions covering every IFM subject module. And if you're serious about passing the IFM board certification exam, practicing full-length case-based exams is essential. Inside my IFM practice exam question bank, you'll find 6 complete 160 question simulations designed to mirror the structure and intensity of the real 4.5-hour exam. If you're ready to test yourself under realistic conditions, find the link to the question bank below in the comments, and I'll see you inside.